Prime Cabinet Secretary, TB coexists with HIV. And as a country, we have been heavily funded, and these programs have depended on donors' funding. However, recently we were classified and we were moved from a low-income country and we are now a middle-income country. And what that means is that in the next few years, donor funding is going to go down. Actually, we have started experiencing the going down of donor funding. Prime Cabinet Secretary, it is now our duty as a country to see how do we sustain these programs beyond the donor funding, which is likely to come and end around 2027. So we have work to do. But I also want to ask of the donors. We lost some time during COVID. So, my friend Diallo, and the rest of the partners from USAID, please take the report that allow Kenya time to get out of COVID, stand before now we can stand on our own on these donor funding programs. Watu wengi ambao wanakuwa recruited wanafikiria ni NHIF yao kibinafsi. Wananchi nataka kueleza, unapoandikishwa kwenye NHIF, kama wewe ni mama, hiyo NHIF inakuchunga wewe mama, inachunga mzee na inachunga watoto. However, we have a challenge, Governor, that when they are going for recruitment and enrollment, most of the people do not have birth certificates. I want to request of you, kindly facilitate that your people get birth certificates, ili kwamba wanapokuwa enrolled katika NHIF, then the dependents are also enrolled into NHIF. Na nadhani tukifanya hivyo, tutakuwa tumecover kila mtu. Prime Cabinet Secretary, allow me to say another thing, that this country, especially in the Ministry of Health, we have people who are minting money from the backs of patients. We have many programs that are vendor driven. And as a Minister of Health, we are not going to allow it to happen. Hatutakubali. Rais anajaribu kushukisha afya chini, lakini kuna wale ambao wanataka kuinua bei ya afya Kenya. Na mimi nitafanya kazi na rais, ninafanya kazi na Prime Cabinet Secretary kuhakikisha ya kwamba afya tunaiweka chini kabisa ili kila mtu akaweze kupata afya.
Our recent engagement with ELSMED has revolutionized technology by making networking easier and transportation of samples easier, including diagnostic sites using drones. This system is the next frontier as it will be instrumental in shortening the turnaround time for treatment.
As a border from this side, we are screening at port of entry from the border and your airport for Marburg. Within this week, you have seen we have reported Marburg fever, which has been diagnosed at Equatorial Guinea and Tanzania. And each country has reported 7 cases. I think we are not going to stop surveillance, even in Eldoret. It's a point of entry. So you have a lot of work to do. I think the question is, we need to work together with the national team. We see how we strengthen the surveillance through primary health care, and we'll achieve UHC. So today, I'm proud to say when we started screening last week, Your Excellency, we have done 132,420 household or persons. Among the 132, we have presumptive, ile tunasema tunafikiria wako na TB, 2,430, and they are living in the community. The ones we took X-ray, they are 610 among our household. Suggestive X-ray, there were 81. So confirmed TB, among the 132, we got 112. That tells you, in this locality, we are not going to stop screening. I think I'm going to request the governor to do it another 2 to 3 weeks. Because it proves that among the screened, we have 5%. The question is, through our CHVs, the community health workers, can we go and identify and start doing contact tracing? CEC Health Eldoret, Wasinigishu, you have a lot of work to do.
I wish to point out that the government has taken up the issue of the community workers and how they can be motivated to continue doing their work. I think we have about 90,000 community workers across the country, and I think from April the government is making the necessary arrangements through the budgetary process so that these workers can also draw a stipend that will support them. I do not want to pronounce a figure at this stage, but we are on track.
We also want our COG, I'm speaking on behalf of the Council of Governors, to thank the national government. Prime Minister Wetu, since the coming in of this administration, previously we had a huge challenge as Council of Governors to work with the Ministry of Health. Everything was a difficult engagement. But in the last 3 or 4 months, the level of engagement between us and the Council of Governors and the Ministry of Health has been very fruitful. A very good example is on the issue of the community health workers. We agreed that we have several donor-funded projects, both other projects funded by national government and by county government. And we are using the same community health workers, but we need to create a synergy so that we can be able to stop giving them stipends and give them a predictable salary so that they can be able to support us across all the programs of government. And we are asking our development partners to come in on this. We have development partners on TB, on HIV, issues of nutrition, and all of them are giving small stipend to our health workers. Why don't we synergize, put them together, give them a good salary, and allow them to help us in achieving, primary health?
Tuberculosis is a serious and potentially fatal infectious disease that affects many people around the world, including Kenya. Globally, as you have heard from previous speakers, an estimated 10.6 million people fell ill with TB in 2021, an increase of 4.5% from 10.1 million in 2020, reversing years of a slow decline. The COVID-19 pandemic reversed progress made in the years up to 2019 and set global TB targets off track. The reductions in the reported number of people diagnosed with tuberculosis in 2020 and 2021 due to the pandemic suggest that the number of people with undiagnosed and untreated TB has grown. This has resulted in an increased number of TB deaths, community transmission of infection, and numbers of people developing tuberculosis. Serikali imepitisha msimamo ama mswada ambao sasa lazima tulete Kiswahili kwa sababu katiba inatambua lugha mbili, Kiingereza na Kiswahili kama official languages. Sasa amri imetoka kwamba ni lazima sasa tuingize Kiswahili kwa mainstream sawa sawa. ili kila mtu tuelewane. Kwa hivyo itabidi kama serikali, na haya nitarudi kusema tena hata kwa kimombo ili partners wetu wafahamu na viongozi wafahamu. Nilikuwa nauliza, ukienda kwa hospitali na madaktari mko hapa, mnatupatia kile kitu kinaitwa prescription. Yani wanakuandikia dawa. Je, hii prescription inaweza kuwa kwa Kiswahili pia? Kwa sababu kuna wengine labda kuna shida, na ukitaka kutibu mtu lazima muelewane kwanza. Kweli ama uongo? Lazima tuelewane, sivyo? Kwa hivyo ikiwa tunataka tusaidie Wakenya wetu wakati tunafanya yale tunafanya, ni pia tena tujue kwamba, je, ukiandikia yule mgonjwa, wacha kumwandikia tu take 3 tablets 2 times per day. Muandikie pia meza tembe 3 mara 2 kwa siku. We have made progress towards reducing the tuberculosis burden in Kenya through robust multi-sectoral partnerships, increased domestic resource allocation for TB programming, rapid adaptation of innovations, and global WHO guidelines recommendations, expansion of TB diagnostic capacities, and improved integration of TB services into other programs, ensuring access to quality tuberculosis services for all. Kenya, in collaboration with our partners, and they have been well represented here, has invested in critical components of TB care and management by doing the following: expanding and strengthening access to the tuberculosis diagnostic network and services through the introduction of high-end diagnostic equipment, introducing digital adherence technology in support of drug adherence, and providing preventative treatment for people at high risk of contracting TB. 3, development and rollout and sustenance of awareness campaigns to create demand for TB services and treatment to completion. Equally, by strengthening the public and private mix. Also by offering free diagnosis, like today, and treatment to all TB clients, providing financial and technical support to healthcare providers, establishing a robust national TB surveillance system, strengthening infection control measures in health facilities, providing social protection to all drug-resistant TB patients by enrolling them for NHIF and providing them with monthly stipends. Serikali imepitisha msimamo ama mswada ambao sasa lazima tulete Kiswahili, kwa sababu katiba inatambua lugha mbili, Kiingereza na Kiswahili, kama official languages. Sasa amri imetoka kwamba ni lazima sasa tuingize Kiswahili kwa mainstream sawa sawa, ili kila mtu tuelewane. Kwa hivyo itabidi kama serikali, na haya nitarudi kusema tena hata kwa kimombo ili partners wetu wafahamu, na viongozi wafahamu. Nilikuwa nauliza, ukienda kwa hospitali na madaktari mko hapa, mnatupatia kile kitu kinaitwa prescription. Yani wanakuandikia dawa. Je, hii prescription inaweza kuwa kwa Kiswahili pia? Kwa sababu kuna wengine labda kuna shida, na ukitaka kutibu mtu lazima muelewane kwanza. Kweli ama uongo? Lazima tuelewane, sivyo? Kwa hivyo ikiwa tunataka tusaidie Wakenya wetu wakati tunafanya yale tunafanya, ni pia tena tujue kwamba, je, ukiandikia yule mgonjwa, wacha kumwandikia tu take 3 tablets 2 times per day. Muandikie pia meza tembe 3 mara 2 kwa siku. Ili watu waanze kuelewa. Na ningependa hata tuende zaidi kama taifa. Na wadhamini wetu tukifanya kazi pamoja tutasaidiana. Tunaweza pia kuweka hiyo kwa lugha ya mama. Mimi kama Muluya nikienda niandikiwe vimira vaga hari kabiri kwidiko. Gavana, hebu njoo hapa uniambie kwa kilugha, hebu eleza hawa watu kwa kilugha meza tembe 3 mara 2 kwa siku.
Luwe kerkeju somo kwa nyilae embetu amu uroitabu mwenye ganamin.
The theme for this year's World TB Day is an urgent call to action. Yes, we can end TB in Kenya. It is a call for unity of purpose, thought and action. On behalf of the government of Kenya, let us all say, yes, we can end TB in Kenya. Hebu nisikie. Yes, we can end TB in Kenya. The implementation of the in-country multi-sectoral accountability framework for TB responses testifies to our commitment to this cause, in line with the 2018 United Nations High-Level Meeting on TB. Through the framework, we bring all stakeholders together to come up with innovative strategies that will help us meet our 2030 targets. We are grateful for the role community health workers, affected communities, civil societies, and donors play. The government will continue to strengthen our collaboration with all stakeholders. We will endeavor to break the barriers in human rights and issues related to stigma and discrimination. I strongly urge all of us to press on, particularly healthcare providers. Let us not relent because we can beat this disease. Yes, together we can end TB in Kenya. And I heard the governor say something here. Pimwa TB, tibiwa, ishi poa, and thank you. I was saying that our constitution recognizes two official languages, English and Kiswahili. And recently, the government made a very firm decision that we now want to also mainstream Kiswahili into all our processes. And the medical field is particularly essential so that we can communicate with the people if we want to achieve universal health care. In Parliament, for instance, there are already standing orders that have been translated into Kiswahili, so they can engage and operate in Kiswahili. But I was just pointing out that when we go to most medical facilities, including into the deep villages in our communities, the prescription is still given out in English. The fastest road to curing people is to communicate fast. So the message we are saying that with the partnership that we have, we should now also have a program where you can support us fully in these campaigns so that medical prescriptions can go in Kiswahili and if necessary can go in our diverse mother tongues so that we can communicate easily with the people, particularly in the rural areas.
Gentlemen, the good news remains that TB is treatable and curable, and our champions proved it to us. With timely diagnosis and treatment, we can overcome it. Unfortunately, access to diagnosis and treatment is often limited, leaving many people without the care they need. In Kenya, recent estimates show that 133,000 people have developed TB. Among them, 16,000 children. This is a huge burden on the health system and a major barrier to economic development. In 2022, the Ministry of Health reported 90,841 tuberculosis cases compared to 77,854 cases in 2021. That means there was an increase of over 10,000 cases from 2021 to 2022. TB remains a leading cause of death worldwide and is the fourth leading cause of death among infectious diseases in Kenya. The burden for TB and HIV and drug-resistant TB remains high. We have made progress towards reducing the tuberculosis burden in Kenya through robust multi-sectoral partnerships, increased domestic resource allocation for TB programming, rapid adaptation of innovations, and global WHO guidelines recommendations, expansion of TB diagnostic capacities, and improved integration of TB services into other programs, ensuring access to quality tuberculosis services for all.
That this country, especially the Ministry of Health, we have people who are minting money from the backs of patients. We have many programs that are vendor-driven. And as a Minister of Health, we are not going to allow it to happen. Hatutakubali. Rais anajaribu kushukisha afya chini, lakini kuna wale ambao wanataka kuinua bei ya afya Kenya. Na mimi nitafanya kazi na rais, ninafanya kazi na Prime Cabinet Secretary kuhakikisha ya kwamba afya tunaiweka chini kabisa ili kila mtu akaweze kupata afya. Na najua wananchi mko na mimi, si namna hiyo? Mnataka bei ya afya ipunguke? Mnataka wapunguze bei? Tunafanya mipangilio, na hivi karibuni, miezi michache tu, tutawaeleza vile namna kulipa NHIF tutakuwa tumepunguza kutoka shilingi 500 hadi shilingi 300. Na nataka pia kueleza ya kwamba sisi kama wizara tumeanza mipangilio ya kuanza afya mashinani. Najua hapa kaunti ya Uasin Gishu tuko na community health workers zaidi ya 2,000. Si wako? CHVs mko hapa? Sasa tunataka kutoa jina ya CHV, tunataka kuwaita community health workers. Na tunafanya kazi pamoja na gavana wenu kuhakikisha ya kwamba, na prime cabinet secretary atawaeleza kile ambacho katika national level tunafanya ili mkaweze kutusaidia kazi ya kuleta afya mashinani.
We have lost 21,000 lives. A serious concern for government. We need to take charge. A drop from 33. At least the previous year we lost 33,000. Last year we lost 21. Mr. Prime Minister, we don't want to lose any more life to tuberculosis in Kenya. With the highest burden of the disease globally. Kenya remains dedicated to the commitments made by the United Nations high-level meetings on TB at the United Nations General Assembly in New York 2018. As a country, we made some commitments, and I want to pronounce that we are on target of the commitments, but we need to do more.